Okay, so this is Hovermatt proning technique in the OR for Rush University Medical Center. So if we're going to prone our patient here, we've got them supine on the Hovermatt, we're ready to go and transfer them onto the OR table, spine table, what have you. And what we're going to do to start is we're going to attach our air supply, inflate, and we're going to transfer over a little bit just to overlap the table that we're transferring onto, just to make sure that we land in the center. We don't want to kind of land in between the two tables. So we're going to inflate, move the patient over, and then we're going to deflate the mat, and then we're going to proceed to tuck the mat fully underneath on the side that we're proning towards. From head to toe, we want to make sure that there's no mat showing. It all has to be under the patient. If it's not fully tucked, it'll kind of inflate out underneath the patient and we'll have to start all over. So you can see we're not using the safety straps here. And once we're in that position with the mat fully tucked, we're going to inflate on the side that we're turning away from. Caregiver on the patient side is going to use the handles to lift up and kind of push over, and then the opposite caregiver is going to receive the patient and usher them down into position. Really, really useful tool when we have very heavy patients that we're proning, because it really does get that initial momentum going. It's not going to do all the work for you, but it kind of just makes it easier to get that motion going. So we'll show you what this looks like here. We've got our air supply snap on the end of the hose. We're going to insert kind of at an angle, matching up the snap on the inside of the mat with the snap on the hose. We're going to Velcro over the top. And then I'm going to hit my adjustable speed button twice, and then my green 34-inch full inflation button, and we'll do this overlap. All right, I'm going to deflate here. And the overlap all depends on the size of your patient and kind of just eyeballing things. Now we're going to start tucking underneath the patient, head to toe, to make sure that everything is tucked underneath. It is ideal to have somebody operating the air supply, of course, and then your typical staff, maybe a few less people because we have this helping us, but somebody definitely operating the air supply, and then your other caregivers doing the proning technique. So now we're going to go ahead and inflate. I'm going to use these handles, usher our patient over, and then we're going to prone into position. So adjustable speed, we'll fully inflate. Then we can just hit the standby button, shut down, and we're in position. Thank you.